Hello, everyone. Today, let's dive into a topic that affects many of us, especially during the winter months: managing high blood pressure. As the temperature drops, it's crucial to understand how cold weather can impact our health, particularly for those with hypertension. Research has shown that high blood pressure during winter is not just a minor concern. It can lead to serious health issues like heart disease, stroke, or even kidney failure, if not properly controlled. So let's explore why this happens and how we can take proactive steps to safeguard our health. First, let's talk about why cold weather raises blood pressure. According to a study published in the European Heart Journal, when temperatures drop, our blood vessels constrict. This constriction increases vascular resistance, which means our hearts have to pump harder to circulate blood. This can raise blood pressure by 5 to 10 mmHg during the winter months. If that's not enough to grab your attention, research from the Journal of the American Medical Association has found that the risk of cardiovascular events like heart attacks or strokes significantly increases on days when there are sudden drops in temperature. This is particularly true for older adults and those with a history of hypertension. Understanding this mechanism is crucial because it empowers us to take preventive measures that can make a real difference in our health. Now that we understand the risks, let's discuss how we can manage our blood pressure effectively during these colder months. The first and perhaps most important strategy is to maintain regular physical activity. Exercise is essential not just for weight management, also for keeping our blood pressure stable. The American Heart Association recommends engaging in at least 30 minutes of exercise 5 days a week. This can reduce blood pressure by 5 to 8 mmHg, particularly in individuals at high risk. So, what if you're not keen on braving the cold for a run? No worries. There are plenty of indoor exercise options to keep you active. You could walk on a treadmill or cycle on a stationary bike, right in the comfort of your home. Yoga is another great option. Practicing poses like sun salutations or incorporating deep breathing techniques can help reduce stress and support your cardiovascular health. If you're looking for motivation, why not join an online workout session? Many platforms offer classes with relaxing background music to keep you engaged and uplifted. If you prefer exercising outdoors, choose the warmest time of the day, typically between 9 a.m. and 4 p.m. Dress warmly, wear gloves, and don't forget a hat to prevent hypothermia. Just remember, it's important to avoid overexertion, as pushing yourself too hard in the cold can strain your heart. Next, let's talk about the role of diet in managing blood pressure. Nutrition plays a crucial part in our overall health, and it's especially important for those looking to control their blood pressure. Research from Harvard University shows that a diet rich in potassium and magnesium can lower blood pressure by 4 to 5 mmHg. So, what foods should we be including in our meals? Leafy greens like spinach and broccoli are fantastic choices. They are high in potassium, which helps eliminate excess sodium from our bodies. Fruits such as oranges, bananas, and apples not only provide potassium, but are also packed with antioxidants that are beneficial for our blood vessels. Whole grains like oats and brown rice can help reduce bad cholesterol and support cardiovascular health. And let's not forget lean proteins. Salmon, skinless chicken, and tofu are great sources of omega-3 fatty acids, which are excellent for heart health. On the flip side, there are foods we should be cautious about. Processed foods can be a hidden threat. The World Health Organization warns that consuming more than 2,000 milligrams of sodium daily increases the risk of high blood pressure, so it's wise to limit canned foods, snacks, and instant noodles. Saturated fats found in fried foods and animal fats can lead to arterial stiffness, so it's best to steer clear of those as well. A simple tip to enhance the flavor of your dishes without adding salt is to use natural spices like garlic, ginger, turmeric, or basil. Not only do they add taste, but they also contribute to heart health. Another effective strategy for managing high blood pressure is to monitor it regularly at home. Investing in a home blood pressure monitor is a great idea. Checking your readings daily, especially in the morning and evening, can help you stay informed about your health. Ideally, we want our blood pressure to be around 120/80 mmHg. If your readings exceed 140/90 mmHg, it's essential to consult your doctor immediately. The National Hypertension Association emphasizes that regularly monitoring your blood pressure allows you to detect abnormalities early and take timely action. Now, let's explore some additional healthy habits that can help manage blood pressure. First up is limiting caffeine and alcohol. Studies published in the British Medical Journal indicate that excessive caffeine can temporarily raise blood pressure, while alcohol can disrupt cardiovascular function. It's all about moderation. Managing stress is another vital aspect. Chronic stress is a significant contributor to high blood pressure. Finding effective ways to relax is essential. Consider practices like meditation, listening to calming music, or even curling up with a good book. These activities can help you unwind and lower your stress levels, which in turn can benefit your blood pressure. And let's not overlook the importance of a good night's sleep. Research from the Centers for Disease Control and Prevention highlights that getting 7 to 8 hours of sleep per night can lower the risk of hypertension by up to 20%. Prioritizing rest is not just a luxury, it's a necessity for maintaining our health. As we wrap up our discussion today, I want to emphasize that managing blood pressure during winter is essential for protecting your health. By adopting the healthy habits I've shared today, you can maintain stable blood pressure levels and reduce your risk of serious health issues. Don't forget to monitor your health regularly. And consider sharing this information with your loved ones. Together, we can support each other in leading healthier lives. If you found this content helpful, be sure to follow this channel for more useful health tips. Wishing you all a healthy and energetic life.